We all know that low back pain and neck pain are pervasive. They're all over the place. We all get it at one time or another, and some people have the misfortune of ending up having spine surgery, good or bad. Most people have good outcomes from it. It's an invasive procedure, it's costly, there's downtime, there's medication involved. As to my left, Dr. Hall, an anesthesiologist, and to his left, Dr. Joshi, who does the spine surgery. How do you feel, Dr. Joshi, from a spine surgery point of view, this is going to affect low back problems?
Well, it's interesting because you wear a hat of a spine surgeon, but you're really trying to help people with the least invasive strategy whenever possible. So as you said, back pain, incredibly common, neck pain as well. And our toolbox is things like medicines and injections and therapy and bracing, and when needed, surgery. But this is really exciting, stem cells that is. It's very exciting because it's one more powerful tool in the toolbox. It is much more minimally invasive than something like a fusion surgery. I'm sure a lot of people out there have these notions of fusion, and it's rightly very daunting. It's taking bones that are used to being moving parts and making them knit together so they're no longer moving.
But and a surgeon that doesn't want to do surgery, how great is that?
Pretty unusual.
Looking for a less invasive way. And I'm with you. I mean, I get, as an anesthesiologist and a pain doctor, I see these people that have had fusions. And a lot of times my only alternative in the past has been to put them on chronic narcotics, which, yeah, does relieve the pain, but also affects their lifestyle from being on a narcotic.
Right.
So now with stem cells, it's offered me a different route to get better function and better mobility.
I think we're learning together how we certainly know that the discs in our low back, which are the main joints, they undergo a slow process of wear and tear in all of us. And in some people, for some reason, as they get older, that leads to injury and pain. So we want to be aware of people's discs and the injury process early on, because we think that putting cells in there from their own body, these stem cells, that has a great ability to stop that injury process. And it's not that bone-on-bone wear would all of a sudden turn into a robust disc necessarily, but if you catch this injury process early on, there's a great potential of these stem cells to stop that injury and stop the pain.
So there's, as we all know, there's been some nice science to support the efforts of stem cells. It's exciting. There's many, many, many studies that are being done internationally as well as in the United States. This has to do, obviously, with total joints, whether it involves knees, hips, and shoulders, that they're used on stem cells most often, and as well as this new pioneering technique that's been going on for a few years now with discs. And instead of having, hopefully, a fusion, this is another alternative.
Well, it's the future of medicine. I mean, right now it's the cutting edge, but it's certainly going to be the future. Stem cell use for a lot of different things is going to be the future that I can see.
And it's viewed differently at different stages. So as you said, right now we're entering this era of how can we harness these cells. And so there's a lot of process of education that goes on and trying to get people to understand that it's not unconventional or controversial. It's certainly not the cells that have drawn scrutiny from the public or politically that come from another source or an embryo. Just to be clear, as we all know, these are cells that come from that same person. It's not like they're taken away and grown in some lab in cell culture.
And that question has came up with me. I've had patients come in and say, well, isn't this controversial? Aren't you guys using embryologic stem cells from fetuses? And I'm clear, that is not what these are your cells from your body that we're putting back in. This is not embryologic or fetal-based stem cells. So.
And in the studies that have been done with stem cells nationally, the rejection factor has been 0. There were thoughts as a side effect because stem cells, what I want the audience to know, stem cells can grow. They can grow they can replace worn out cartilage, they can replace worn out bone, they can replace injured cartilage and injured bone and muscle. And that's the beauty. The nice thing about adult stem cells is they stop. There's what they call a contact inhibition. They stop growing when they contact each other, unlike embryonic stem cells, which have a greater chance of what they call a cancer situation. And there's studies out there that have shown how safe stem cells have been. I also want the audience to know that many people are not stem cell candidates. We are on that note, they're not a stem cell candidate. There's some other things that we can do in our armamentarium, injection-wise, to treat pain. But when certain people have certain needs for joint replacements and for pain, this may be another alternative. And there's even thought in the literature that this may one day replace, if they can be done cheap enough and inexpensive enough, corticosteroids, which are steroid injections into spines and joints.
And I've seen that too. I've had the patients come in that do have a totally worn out joint, and certainly we're not going to expend their money to do stem cells on them when I don't think it's going to work. Those are the people that we refer on, either, like you said, interventionally treat with another type of injection, or possibly refer on to a surgeon for a surgical care. So.
To tie a couple of these concepts together, we've talked about spinal settings for using stem cells, but we've also been talking about total joints. So I really like that we went from concept among the three of us to proof of concept. You guys did a great job studying and offering these treatments to patients and making sure that we followed how they did and getting questionnaires to document pre-treatment pain levels and post-treatment pain levels. But you did that not just in the spine, but in the knees and the shoulders and the hips. So from my background in orthopedics, even though I focus on spine now, I think that this is a technology and a treatment that we can apply broadly within the musculoskeletal realm of orthopedics.
No, we've had our patients fill out their share of forms, that's for
sure.
Yeah,
they do, because it's really essential that when we're talking to patients initially, we want to have some sort of reference of how effective these have been in the past and what the literature and what other people who are using them. There's not a lot of people who are doing musculoskeletal stem cells out there. There's a few things we do. We use ultrasound, so we're making sure when we're injecting the joints, and that gives us precision documentation that we're getting the stem cells or whatever we're putting in the joint into the right place. When we're doing an injection in discs, we actually use ongoing X-ray, live X-ray during that time, called a fluoroscopy. But another aside, what's been our three experiences, is when we started this project, we started it with very difficult orthopedic patients. The patients were great, but they were either too old to have a joint replacement, or they were too young to have a joint replacement. And our success rate in our pilot study showed numbers at 79.8% relief after 6 months. And what was really interesting about that is they had a lot of relief from 1 month to 3 months, but they had as much relief from 3 months to 6 months. So we've been all very satisfied and excited about where we're going with this, and it's a new day here in pain medicine and orthopedics in another part of our armamentarium of offering patients hope.
It's a great alternative to a lot of other traditional forms of treatment, and I'm really glad that I'm actually involved with it.
Very exciting, as you said, a new day, and it's great to be involved with it.
Thank you for joining us today. We hope we've been a little helpful in your future decision making. There are alternatives out there from a pain management point of view and an orthopedic point of view. The science literature is booming right now for stem cells, and it's an exciting time for us as physicians and pain medicine doctors.
We're looking to treat this exchange and this website in general as an educational resource for people in the community who have an interest to learn more. Stem cell therapies, also known as regenerative therapies, are powerful, and the science is evolving at a rate that is really astounding. So information that comes out now is enhanced and complemented by information that comes out in a couple of months or in 6 months. So it's our goal to stay on top of all that information and to use it appropriately to help our patients in the best possible way. So this isn't just about looking for a therapy that may be necessary for you as a patient, but this is about trying to be an informed consumer and to understand options that are out there for your health care.